cases of spinal cord compression, we have already discussed about spina bifida, Chiari malformation, lipoma, split notochord syndrome, and neuroenteric cysts. Next, we have diastematomyia. It is a congenital disorder in which the spinal cord splits usually at the level of upper lumbar region. Females are more commonly affected. It is often termed as spur and hypertrichosis in association with spina bifida occulta. Occurs due to the presence of osseous, cartilaginous, or fibrous septum in the midline of spinal canal during 3 to 4th week of gestation. When the split does not unite distally, it is termed as diplomyia. Neurological symptoms are non-specific, often related to the course to the other spinal cord malformations, and the course of the disease is progressive.
Apurva, how many lines are there in the slide?
Ma'am, there are 7 points.
7 points. I am talking about the lines. It is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13.
Yes.
With or except references.
Yes, ma'am.
पता है ना लाइंस कम होनी चाहिए, ठीक है 6 और 7 ना रखो, तो एटलीस्ट 8 9 में खत्म कर लो.
ठीक है मैम. मैम एक्चुअली वो पहले वो थी प्रेजेंटेशन की, वो 50 स्लाइड से ज्यादा की थी, तो वो शेयर नहीं हो रही थी, इस वजह से उसको सम अप करना पड़ा.
चलो ठीक है, कंटिन्यू करो.
ओके. Symptoms appear due to loss of movement at the spinal cord. Movements cause abnormal stretching of the spinal canal, which leads to tethered cord-like symptoms. In childhood, the symptoms like ankle and foot abnormalities, weakness in leg, incontinence, low back pain, and scoliosis are most common. Whereas in adulthood, progressive sensory and motor abnormalities like paraparesis, paralysis, and sensory loss of bladder and bowel control are more common. Delay in presentation of symptom is due to degree of strain placed over the spinal canal. Next is, in these figures, this is if in the first figure, if the transaction is towards the end of the spinal canal, then it is termed as diplomyia, whereas this is termed as diastematomyia. And this is surgical incision, as mentioned in the article. Ma'am, this the fourth picture is the photo of an MRI of a child in which two spinal canals are visible below the lumbar lesion. Next is caudal regression syndrome, the disorder in which there is agenesis of the caudal vertebra. First described by Duhamel in 1961, it is a genetic abnormality like genitourinary and gastrointestinal problems persist. Incidence is 1 to 5 cases worldwide among every 1 lakh childbirths. Majorly syndrome is associated with the causal factors maternal diabetes, either type 1 or type 2. It is generally caused because when the gestational diabetes is persistent throughout from the starting of the pregnancy, and which causes genetic mutations within the fetus. The results due to hyperglycemia, infections, toxic and ischemic insults before 4 weeks of pregnancy. Due to disturbance of primary neurulation process, primary clinical symptom is neurogenic bladder. Also termed as sacral agenesis due to abnormality of somite formation and disarrangements in the gene hox. This gene hox is responsible for neurulation formation and the development of spinal cord from the 3rd week to up to the 11th week of gestation, and somite formations are. Hello.
हाँ बोलो.
Okay, ma'am. Somite formation, there are various somites formed in the throughout the gestation period, in which cervical, thoracic, lumbar, and sacral somites are different. Every region has different somite, and when they are matured, they unite at the end of 8th week, and in the formation. Sorry, ma'am.
कुछ नहीं बोलो.
And in the in the course of somite formation, there occurs an abnormality due to mutation in gene hox, which causes caudal regression syndrome. Sensory motor paresis, narrow hips, hypoplastic gluteal muscles, mild yes, ma'am.
Where this gene hox located? Do we have the precise location of this gene hox?
No, ma'am. Mostly in chromosome 22, it was in some articles, it is written that gene hox is present over the chromosome 22, and in some articles, it was written over chromosome 19.
Okay, okay.
Sensory motor paresis, narrow hips, hypoplastic gluteal muscles, mild foot deformities, and gait abnormalities are common. CRS occurs in 1% pregnant women with diabetes. Radiological features show cigar-shaped conus medullaris. Conus medullaris becomes blunt and ends above the normal level. Absence of lumbosacral elements. Iliac bones overlap at the midline, and ultrasound images show cross-leg images of the fetus. Ma'am, as we can see in the above first picture in the slide, the narrow hips and iliac bones overlapping is present over the midline. There are 4 types of caudal regression syndrome, 4 grades: grade 1, grade 2, grade 3, and grade 4. Grade 1 is stable absent hemisacrum. Grade 2 is stable L5 articulates with S1. Grade 3 is stable L3 articulates with ilium, and grade 4 is unstable L3 lies adjacent to the ilium. This is the total grading. Type 1, total or partial unilateral sacral agenesis. Type 2 is partial sacral agenesis with a partial but bilaterally symmetrical defect and a stable articulation between the ilium and a normal or hypoplastic first sacral vertebra. This is the most common and most prevalent type. Type 3 is variable lumbar and total sacral agenesis with the ilia articulating with the sides of the lowest vertebra present. Type 4 is variable lumbar and the total sacral agenesis, the caudal end plate of the lowest vertebra resting above the either fused ilia or an iliac amphiarthrosis. Type 5, one set of leg tissue is absent, also known as sirenomelia or mermaid syndrome. It is sometimes considered as a type of caudal regression syndrome. This classification is known as Renshaw's classification for caudal regression syndrome.
Apurva?
Yes, ma'am.
Like these are 4 pictures, and you have described the 5 types. So,
yes,
what about like one set of leg tissue is totally absent, so leg tissue पूरा नहीं है एक साइड में, जिसको हम मरमेड सिंड्रोम बोलते हैं.
Yes, ma'am.
So, अगर पूरा का पूरा नहीं, तो मरमेड में कैसे होते हैं कि वो फ्यूज टाइप होते हैं.
Yes, ma'am.
तो ऐसा कुछ है कि फ्यूज होते हैं, या फिर वो पूरा का पूरा लेग टिश्यू होता ही नहीं है.
मैम, बोनी और कार्टिलेजिनस टिश्यू नहीं प्रेजेंट होता है स्टार्टिंग फ्रॉम द सेक्रम. सेक्रम के बाद से एक साइड का लेग टिश्यू नहीं होगा, बोनी और कार्टिलेजिनस. स्किन फ्लैट प्रेजेंट होता है, लेकिन मैम वो जनरली ड्यू टू डेवलपमेंट सेकंड लेग से फ्यूज हो जाता है. मैम, इसकी मरमेड सिंड्रोम की फोटोग्राफ्स मिली थी मुझे, बट वो थोड़ा रिलायबल सोर्स नहीं था, इसलिए मैंने इसमें अटैच नहीं करी.
अच्छा, तो इसमें जैसे कि एक साइड का लेग, या हम कह सकते हैं कि जो वन सेट है लेग टिश्यू का, वो नहीं है. सो जो है इस यहाँ पे जो इसके पास है, तो वो जैसे कि अभी क्या होता है कि हमारा राइट साइड या लेफ्ट साइड में होता है.
यस मैम.
बट यहाँ पे जो है वो सेंटर में रहेगा या फिर एक ही साइड पे रहेगा?
मैम एक ही साइड पे रहता है, बट सेकेंड साइड का बस फॉर्म्ड नहीं होता है और टूवर्ड्स मिडलाइन होता है, जो सिंगल लेग होता है वो मिडलाइन शिफ्टेड टूवर्ड्स मिडलाइन शिफ्टेड होता है।
अच्छा ठीक है।
Recent treatment includes growth hormone alongside rehabilitation. Growth hormone was administered 0.3 mg per day for 5 days a week for 3 months, and low-level laser therapy for inducing continence for about 3 months. Ma'am, this is a picture with type 2 CRS child, and post 3 months the child was able to walk on with the help of crutches and canes. Ma'am, in this article they haven't discussed about the rehabilitation they have provided the child, but they have mentioned about the growth hormone parameters, low level laser therapy, and they have also mentioned that rehabilitation starting from the first day after childbirth is beneficial for such children. Next is segmental spinal dysgenesis. It is an umbrella term used for various anomalies like segmental agenesis of thoracic or lumbar spine, segmental abnormality of the spinal nerve or nerve roots, congenital paraparesis or paraplegia, and congenital lower limb deformities. Complete disconnection at the level of dysgenesis occurs. Normal upper spinal cord, abnormal affected cord devoid of spinal nerve roots with bulky thickened distal cords. Most of the children present with kyphoscoliosis and motor impairments, reduced tendon reflexes and neurogenic bladder, anorectal anomalies with bilateral dysplastic hips present in nearly 90% of cases. Type 1 SSD consists of mild congenital kyphoscoliosis, bulky distal cord without significant spinal canal compromise. Ma'am, these are the various differential diagnosis for segmental spinal dysgenesis: caudal regression syndrome, congenital vertebral displacement, and multiple vertebral segmentation disorders. Type 1 basically occurs due to the loss of embryogenesis of spinal canal. Studies show close correlation to vitamin A deficiency in embryos. In type 2 SSD, there is segmental malformation of multiple vertebrate, spinal cord, and underlying nerve roots, causing severe kyphoscoliosis, gibbous formation, and severe spinal canal narrowing. Mutation in the Notch signaling pathway. Notch signaling pathway is basically the pathway for working of the gene HOX. This gene HOX is responsible for development and maturation of neurulation process. When Notch signal and gene HOX are not working in correlation, then abnormalities like caudal regression syndrome and SSD occur. Sorry. Congenital vertebral defects are the primary cause of type 2 SSD. Vertebral anomalies like hemivertebra, block vertebra, etc., causing spinal canal compression, wedge-shaped vertebra, paraplegia due to congenital spinal stenosis occurs. Ma'am, these are the CT scans for MRI scans T1T2 weighted for various types of canal compression due to SSD. Next is congenital scoliosis. Ma'am, this is the physiology behind congenital scoliosis. When the pregnant woman is is suffering with hypoxia, then notch pathway is hampered, which causes patterning segmentation clock. Bring in segmentation clock. Segmentation clock basically rejoins the various somites which are present in embryos for cervical, thoracic, lumbar, and sacral regions. Then phenotype scoliosis and congenital scoliosis occurs. If the mother is having normal oxygen level and normal oxygen to the tissues, then north pathway is normal, segmentation is normal, and scoliosis is less frequent, lower incidence. Whereas in hypoxic mothers, the incidence is quite higher for congenital scoliosis.
But why you have shown these rats type?
Yes, ma'am.
ये रैट में क्यों दिखाया है?
मैम ये आर्टिकल में रैट के थ्रू ही एक्सप्लेन किया गया था, बट उसमें ये स्पेसिफिकली मेंशन है कि ह्यूमंस में, मंकीज में और स्पैरोज में भी सेम वो होता है,
तो ऐसा मतलब कि हम ये कह सकते हैं कि अभी तक जो है, अगर कोई कंजेनिटल स्कोलियोसिस का पब्लिकेशन है ही नहीं ह्यूमन से रिलेटेड।
मैम सिर्फ ह्यूमन से रिलेटेड नहीं है, कंजेनाइटल स्कोलियोसिस की फिजियोलॉजी, पैथोफिजियोलॉजी मैम सबने विटामिन ए और ऑक्सीजन से कोरिलेट तो करी है, बट किसी में ये फ्लो चार्ट नहीं मिला था मुझे, सिर्फ एक ही आर्टिकल में मिला था, इसलिए मैंने लगा दिया।
वो तो चलो ठीक है, लेकिन हम ये कह सकते हैं कि कंजेनाइटल स्कोलियोसिस का कितना प्रेवलेंस कितना है?
मैम 1 to 4%।
1 to 4% ऑल ओवर द वर्ल्ड?
यस मैम।
या पर्टिकुलर कंट्री में?
मैम वर्ल्ड वाइड।
वर्ल्ड वाइड मतलब पता नहीं कितनी पॉपुलेशन में केवल 1 या 2%, 1 या 4% बच्चों को होता है।
लिखा हुआ था ऐसा।
हाँ, मैं पूछ रही हूँ, आई डोंट नो अबाउट दिस।
हाँ मतलब मैम उस आर्टिकल के अकॉर्डिंग कंजेनाइटल स्कोलियोसिस इज लेस कॉमन, क्योंकि मोस्टली जब फीमेल्स प्रेग्नेंट होती हैं तो उनको फोलिक एसिड और विटामिन ए के सप्लीमेंट्स मिलते रहते हैं, जिसकी वजह से हाइपोक्सिया कॉज होना बहुत लेस फ्रीक्वेंट होता है।
ओके ओके, सो इसीलिए मतलब कि क्योंकि प्रोबेबिलिटी जो है, हो सकता है कि आर्टिकल्स हो ही ना इसके ऊपर कि जहाँ पे या कोई इंसिडेंस ही ना मिला हो पेशेंट का, जहाँ पे कि वो उसको विजुलाइज करा सके कि पेशेंट की ऐसे हमें दिखेगी। दैट मीन्स कि जो हमें दिखना चाहिए, जो हमें एक्सरे या कुछ भी ऐसे हमें जो विजुलाइजेशन हो सकता है चाइल्ड का, ऑल्दो ये भी एनिमेटेड ही है, तो they could also animate in the form of child also. If this article is not related to rat, अगर ये आर्टिकल रैट पे नहीं है, then they could put the animated pictures of a child also.
यस मैम। मैम इन्होंने बेसिकली रैट पे स्टडी किया था और सिर्फ डिस्कशन में एक पार्ट लिखा था कि सेम प्रोसेस जो होता है वो ह्यूमंस में और बाकी में फॉलो होता है।
हाँ, दैट्स व्हाई, क्योंकि उन्होंने रैट पे स्टडी किया, उन्होंने रैट लगाया।
यस मैम।
ठीक है।
और मैम इन्होंने एक चीज और लिखी मेंशन करी थी कि कंजेनाइटल स्कोलियोसिस का जो डायग्नोसिस होता है वो बेसिकली जब चाइल्ड अटेन कर लेता है 4 से 5 साल की एज, उसके बाद डायग्नोज होता है। तो ड्राइंग कंक्लूजन कि वो कंजेनाइटली है या किसी और अनोमली की वजह से हुआ है, ये थोड़ा क्वेश्चनेबल हो जाता है।
ऐसा कोई असेसमेंट फॉर्म नहीं है जिससे कि हम कंजेनिटल स्कोलियोसिस को डायग्नोज कर सकें?
मैम मुझे तो नहीं मिला था।
ओके, ठीक है, गो अहेड।
Vertebral anomalies within 5 to 6 weeks of gestation cause abnormal growth of spine and deformity. No genetic etiology is said to be associated. Defined as lateral curvature beyond 10 degrees, also known as Cobb's angle. Primary cause due to vertebral anomalies like hemivertebra, complete of vertebra, wedge vertebra, partial formation of vertebra, unilateral unsegmented bar, unilateral failure of segmentation, and block vertebra, bilateral failure of segmentation. It is most commonly seen at the thoracolumbar junction, thoracic region, and upper thoracic region in descending pattern. It is most common in thoracolumbar region, then less common in thoracic region, and least common in upper thoracic region. The prevalence of disease is 1 to 4% childbirths worldwide. Congenital scoliosis children usually get detected before the 3 years of age, but in the second article it was mentioned that management of scoliosis is better if diagnosed before 3 years of age. Otherwise, children are usually between the age of 4 to 6 years. 26% patients deal with cardiac anomalies, 21% deal with genitourinary anomalies. Major treatment strategies include casting, physical therapy interventions, and in extreme cases, surgical intervention, often associated with Chiari malformation, tethered cord syndrome, lipoma, and dystomatomylia, etc. Surgery is indicated in rapid progressive congenital scoliosis only. Bracing is not recommended in this condition. Congenital kyphosis. In normal individuals, cervical spine is lordotic, thoracic spine is 20 to 50 degrees kyphotic, lumbar region is again lordotic, and sacral region is kyphotic. Kyphosis of greater than 50 degrees in thoracic spine is considered as abnormal. Abnormal curving of spine causes slouched posture, which is termed as kyphotic posture. Vertebra may be malformed or fused together. It is quite uncommon with frequent defects. In this, the spinal deformity increases with growth. There are basic three types of congenital kyphosis. Type 1 is congenital failure of vertebra formation. Type 2 is failure of vertebral body segmentation, and type 3 is combination of failure as well as segmentation of the vertebral body. Most commonly occurs at the thoracolumbar region and lower thoracic region. Bracing has no role in congenital scoliosis and kyphosis. Surgical interventions like posterior fusion, anterior fusion, or anterior osteotomy with posterior fusion could be opted for better results. Progression of kyphosis may lead to paralysis. Larger deformities may lead to obstruction to movement and pain. Klippel-Fields syndrome. It is a congenital defect in the cervical vertebra which includes fusion of two or more vertebrae. There are basic three types of Klippel-Fields syndrome. Type 1 is fusion of whole cervical spine. Type 2 is fusion of one or two cervical spine. Type 3 is type 1 or type 2 with thoracic and lumbar spine anomalies, which can be kyphosis, scoliosis, or fusion. Also termed as congenital brevicollis syndrome. It is an autosomal dominant disorder. Distinctive feature includes short statured neck, limited range of motion, which is very low than normal ranges, and low hairline at the neck. Neural compression occurs at the spinal foramina, which creates pain, radiating type at the fused vertebral level. As age and disease progresses, it leads to spinal stenosis. Vertebral artery is a common vertebral artery compression is a common anomaly in patients caused due to genetic mutation of GDF6 and GDF3 genes, which are present at chromosome 22. These genes are responsible for bone formation and bone development, often related to spina bifida and scoliosis. Often delay in treatment leads to development of radiculopathy and myelopathy. Physiotherapy along with NSAIDs and opioids are the key treatment procedures. Surgical interventions are not frequent with the disease. Major symptoms include paralysis, ataxia, hearing problem, vertigo, and in severe cases, spasticity. Teratoma. Teratoma are a group of cells having teeth, hair, nails, and cells just like a fetus. Due to abnormal differentiation of fetal germ cells, teratoma occurs. Sacrococcygeal teratoma form 40% of the teratomas, and other common sites are cervical spinal canal, mediastinum, brain, etc. Women are more commonly suffer from benign and mature teratomas, whereas males commonly suffer from immature and malignant teratomas. Various types of teratoma like spinal dermoid cyst are most commonly in the lumbosacral region and cause neural tube closure. Diagnosis is made through ultrasound and MRI scans in the prenatal period. Ma'am, the second picture shows cervical teratoma with the arrows, and the first picture is of hymus teratoma.
So these are cells, na? These are group of cells like.
Yes, मैम जर्म सेल्स होते हैं जो फीटस की तरह हेयर स्नेल स्केल्स होते हैं, लेकिन वो एक ट्यूमर फॉर्म हो जाता है उस जगह पे.
These are live cells actually.
Yes, ma'am, these are live growing cells.
उस सेल के टीथ भी है, हेयर भी है, नेल्स भी है, और ये
मैम जर्म सेल से बना होता है, जो बॉडी में कहीं भी फॉर्म हो सकता है, ट्यूमर टाइप का होता है, बट ग्रोइंग ट्यूमर होता है। और जो सेल्स होते हैं उनमें सोमैटिक डिवीजन होता है, जिसकी वजह से वो हमारे हेयर नेल्स को डिस्टिंक्ट करता है।
मतलब एग्जैक्टली टीथ, हेयर और नेल्स होते हैं उनमें, या फिर वो इट लुक लाइक कि उनमें टीथ, हेयर और नेल्स हैं?
मैम होते हैं, टीथ कॉमनली देखे गए हैं और हेयर देखे गए हैं, बाकी नेल को डिपिक्ट करते हैं।
एक्चुअली सेल तो बहुत ही माइक्रो ऑर्गेनिज्म हो गया ना।
यस मैम।
तो उस माइक्रो ऑर्गेनिज्म में भी टीथ है?
यस मैम।
कोई पिक्चर है इसकी टीथ वाली?
मैम गूगल पे आर्टिकल में तो नहीं थी मैम, लेकिन गूगल पे शो कर रही थी
टीथ की पिक्चर।
यस मैम।
देख लेते हैं।
अच्छा, मतलब तेरे को ना काइंड ऑफ सेल है जो नेल्स भी हो सकते हैं ना।
मैम मैंने ग्रुप पे भेजी है फोटोग्राफ।
इसमें तो वही दे दो
देखो ये कैरेटोमा है,
सेल्स नहीं बोलेंगे, वो हेयर भी हो सकता है।
वो एक्चुअली ग्रुप ऑफ सेल्स है ना। तो ग्रुप ऑफ सेल्स जो है वो उनके अंदर जो ओवरग्रोथ हो रही है वो टीथ की फॉर्म में भी हो सकती है, हेयर की फॉर्म में भी हो सकती है, और नेल्स की फॉर्म में भी हो सकती है।
यस
ऐसे ही लिखेंगे, सेल्स हैविंग टीथ, हेयर, नेल्स।
क्या?
नेल्स की जगह टीथ।
हाँ हाँ, तो वही तो दिखा रही है वो। देखो
इसको ऐसे ही डिफाइन
जाइंट टेरेटोमा, ये वाला। आई देखो उसकी कितनी बड़ी है।
यस
ये आई है, ये देखो।
ये केंद्र तो कम होते होंगे, इसमें जो यहाँ पे भी पिक्चर
देख देख इधर लग रहा है।
टेस्टिकल एंड कॉक्सिस में ज्यादा होते हैं।
वही बहुत ही बुरा है ये तो। देख देख
यस
के
मैम,
कैसा हो रहा है।
इसीलिए मैम फोटो
कितना अच्छा, इसीलिए वीडियो दिखाई तुमने।
नहीं, इसलिए प्रेजेंटेशन में नहीं लगाई थी।
हम इसको ऐसे ही डिफाइन करेंगे, ग्रुप ऑफ सेल हैविंग टीथ, हेयर, नेल्स।
तुमने कौन सा ग्रुप में फोटो भेजी है अपोलो?
मैम न्यूरो मैम वहाँ पे अगर मनप्रीत का मालिका कविता हो तो वो दिखाइए।
दिखाओ कौन सी फोटो भेजी है।
ये वाली भेजिए।
हाँ। तो हेयर भी है और टीथ भी है उसमें। चलो। हाँ, अजीब अजीब सी बीमारियां हैं बेचारे।
तो हम इसको ऐसे ही डिफाइन करेंगे।
इसको हम दिखाना, जरा पीछे वाला स्लाइड दिखाना पूरा।
यस मैम।
हाँ, ऐसे ही डिफाइन करेंगे। टेराटोमास आर ग्रुप ऑफ सेल्स हैविंग टीथ, हेयर, नेल्स
एंड सेल्स लाइक द फीटस।
हाँ ठीक है, चलो आगे चलो।
मैम एक स्कैन की मैंने फोटो भेजी है।
फिर वही भेजी होगी।
नहीं नहीं, इस बार अच्छी वाली है। हाँ मतलब वही उसी ग्रुप पे भेजी है।
तो इसमें क्या दिख रहा है स्कैन में?
मैम ये मेल्स में है, जिन मेल्स में मतलब जिनका बहुत ज्यादा बेली फैट आ गया होता है, उनमें एक ही टेरेटोमा की फोटो थी, मैच्योर सिस्टिक टेरेटोमा।
और इसके आगे जो छोटी 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 सेल्स हैं, ये क्या है?
मैम ये इन द ड्यू कोर्स ऑफ फॉर्मेशन।
चलो।
Often correlated with Steele syndrome, in which the fetal blood supply is diverted towards the teratoma. Prevalence is 1 in 35 to 40,000 cases. 30 to 50% cases are diagnosed prenatally. Fetal sacrococcygeal teratoma are the most common congenital germ cell tumor. Cervical teratomas lead to hyperextension and flexion of the neck of child towards one side. Cervical
और
teratomas cause
कोई
neonatal.
etiology है बोलो?
Yes, ma'am.
इसकी कोई etiology है, कोई fixed etiology है इसकी?
नहीं मैम, कोई etiology नहीं है.
तो किस वजह से हो सकता है ये?
मैम जितना मैंने पढ़ा था कि जब मदर्स बहुत ज्यादा रेडिएशन में या कीमोथेरेपी को बहुत ज्यादा फ्रीक्वेंट होता है उनका कोर्स, तब उस केस में ट्यूमर जो होते हैं वो हो जाते हैं, और क्योंकि प्रेगनेंसी के टाइम पे जर्म सेल्स जो होती हैं बॉडी में डेवलप कर रही होती हैं, तो कुछ जर्म सेल्स जाके टेरेटोमा फॉर्म कर देती हैं. बट मैम इसकी कोई फिक्स्ड एटियोलॉजी नहीं है, ना ही ये किसी आर्टिकल में लिखा हुआ था. ये बस एक ब्लॉग था जिसमें मैंने ये पढ़ा था.
ओके, ठीक है.
Cervical teratomas cause neonatal airway obstruction. Surgical and chemotherapeutic interventions are the mainstay treatment available. Ma'am, these are the photographs of cervical and thymus teratomas in prenatally.
Okay.
Next is Scheuermann's disease, also known as juvenile kyphosis.
केवल सर्जिकल मैनेजमेंट ही है उसका?
Yes, ma'am. सर्जिकल इंसिजन ही मेन से मैनेजमेंट है.
सर्जिकली बिल्कुल ठीक हो जाता है?
मैम ठीक हो जाता है, मोस्टली 35% केसेस में ठीक हो जाता है, और इसका जो रीअकरेंस रेट है वो 1% है.
अच्छा, ठीक है. ओके.
Scheuermann's disease, also known as juvenile kyphosis, it is due to deformed thoracic or thoracolumbar region. It causes increase in kyphosis and leads to various anomalies. Stooped posture is seen due to wedge-shaped vertebra, commonly diagnosed between 12 to 14 years of age. Wedge-shaped and deformed posture causes anterior longitudinal ligament to get thickened at the site. At the site of deformed vertebra forms the Scheuermann's nodes. Varied signs and symptoms occur due to compression of the spinal cord at that level. Basic signs include muscle cramps, chest pains, formation of hump while bending. In rare circumstances, decreased lung capacities and breathing difficulties persist. And this is the hump which is formed, and this is the region of juvenile kyphosis. This anterior longitudinal ligament is thickened at the site of kyphotic curve. Major complications include rheumatic low back pain, progressive deformity, neurological deficit, and cardiorespiratory deficits. Compression occurs at the initial starting level of kyphosis. Diagnosis can be made on the basis of X-rays and posture analysis. Management depends on the degree of kyphosis. Surgical posterior spinal fusion can be done to reduce the curvature in extreme cases. For pain management, post heat packs, cryotherapy, shortwave diathermy, etc. are useful, and physiotherapy along with braces is recommended. Ma'am, this is TLSO brace, which is recommended for such patients. And in an article, it was written that apart from other braces, TLSO brace is the most frequent and most appropriate for this disease. These are the Scheuermann's nodes present over the juvenile kyphotic site. Next is tethered cord syndrome. Tethered cord syndrome is a group of signs and symptoms of motor and sensory abnormalities as a result of tension in the spinal cord and canal. Abnormally low position of the conus medullaris is seen in such cases. As the traction and stress over the spinal cord increases, blood flow and oxidative metabolism gets hampered. Causes may be varied like spina bifida, split cord formation, lumbosacral lipomas, neuroenteric cyst, myelomeningocele, etc. In neonates, urinary dripping may be the first sign apart from radiological features. Scoliosis and lower extremity deformities are common. Children usually present with progressive motor dysfunction, sensory anomalies, scoliosis, foot deformities, decreased control over bladder and bowel, etc. These are the images of tethered cord. Pain is somewhat restricted to the low back region. Limb length discrepancies and gait abnormalities are frequent in children. Spasticity and clonus appear. Most commonly, detrusor hyperreflexia is present. Symptoms are present only in patients with worsening conditions. There may be condition where tethered cord is present without any symptoms. Surgical intervention includes untethering of spinal canal. Physiotherapeutic intervention is rendered symptomatically. Complications which may persist post-surgical intervention include infection, bleeding, damage to the spinal cord, loss of bladder and bowel control permanently. Ma'am, these are pre and post pictures of tethered cord syndrome due to neuroenteric cysts. This was the last disease.
Okay. So I hope the congenital conditions has been completed.
Yes, ma'am.
Good. Now, Kavita, do you have anything to present? Okay, Apurva, share the slides in the group also, and in the group in which मैं भी हूँ उसमें जिसमें.
Yes, ma'am. Yes, ma'am. Ma'am, can I stop sharing?
हाँ जी, हाँ जी, हाँ जी.
Thank you. Thank you.
रिजल्ट थोड़ी ना बताना दोबारा से. ये रिजल्ट तो अच्छा रिजल्ट दोबारा थोड़ी ना बताओ. रिजल्ट तो रिजल्ट में बता दिया ना. ये दोबारा बता दीजिए. सारी चीज दोबारा बता दीजिए. पूरा रिजल्ट तुमने दोबारा बताया यहाँ से. आपने इस तरह से लिखना उसके बाद क्यों ना. हाँ, तो वो लिखो बस. जो ये वाला लाइन है ना, केवल ये लिखो. तुम बस ये लिखो कि जैसे कि 30%
This is the blood supply of the spinal cord. This is the blood supply of the spinal cord, which is supplied by the aortic and vertebral arteries both. स्लाइड शो नहीं हुआ अभी शेयर हो गया पर इसमें स्लाइड शो ऐसे नहीं है नेक्स्ट चल रहा है इस पे स्लाइड शो हो गया ऐसे नहीं Mainly two arteries supply to the spinal cord, anterior spinal artery, posterior spinal artery, anterior two-thirds of the spinal artery.
अपूर्वा तुम्हें सुनाई दे रहा है? अपूर्वा तुम्हें सुनाई दे रहा है?
यस मॉम
बोल रही हूँ।
अपूर्वा हेलो यस मॉम
अपूर्वा तुम्हें सुनाई दे रहा है?
यस मॉम हल्का है बट सुनाई दे रहा है स्पीकर की आवाज
नहीं आ रही?
जा रही है मुझे anterior spinal artery and posterior spinal artery. Anterior two-thirds of the spinal cord is supplied by the spinal cord is supplied by the posterior spinal artery and there are two posterior spinal arteries. These are the branches of the vertebral artery and aorta gives the branches of Adam Queeks which supply the anterior part of the spinal cord. Radicular through radicular anterior artery, radicular posterior artery, and these are the spinal branch of the aorta. And as per the function, the anterior spinal artery supply to the anterior and the lateral cord, and posterior to the dorsal column of the spinal cord. Then what is vascular myelopathy? It refers to the spinal cord injury secondary to the ischemia or hemorrhagic compression of the spinal cord.
स्लाइड शेयर मत करो स्लाइड शो में तो तुम भी अपना इसे में ही करो तुम अपना स्लाइड शो में मत खोलो बिना स्लाइड शो के खोलो ऐसे तब चेंज हो जाएगा हमारा तुमने स्लाइड शो खत्म कर लिया अपना तो दोबारा रीलोड करो इसको एग्जिट कर दो हो गया चेंज हो गया देखो इटियोलॉजी आ गई
Etiology of the vascular myelopathy. It is secondary to the tissue infarction which is caused by the spinal cord ischemia or hemorrhage to the spinal cord. Mostly, it is focal loss of aortic blood supply to the cord during any surgery, that is thoracoabdominal aneurysm repair, aortic atherosclerosis, or aortic dissection. Basically, two main causes are present there. Firstly, systemic hypotension, which includes intraoperative hypotension, cardiac arrest, and aortic cross clamping. And in embolic infarction, it includes the fibrocartilaginous material from the herniated intervertebral disc, atheromatous plaques,
or cardiogenic sources. And venous infarction has also been reported in the spinal cord injury, which is due to the occlusion of the venous drainage of the cord. In a spinal cord, the venous has no valves. That's why the more chances of the venous infarction is there. Uh, in Valsalva and when Valsalva and increased abdominal pressure, these both causes the compression of the venous and cause the infarction to the spinal venous. And veins are also of two type, anterior and posterior vein of the spinal cord. Vascular myopathy also seen when bleeding within the spinal cord, yeah, or arteriovenous malformation, arteriovenous fistulas, or spinal subarachnoid epidural subdural hemorrhages. Other causes of the spinal cord infarction includes vasculitis, whether there is any infection or inflammation of the vessels resulting from bacterial or cephalid infection, systemic lupus erythematosus, polyarthritis nodosa, radiation-induced myelopathy, cocaine-related arteriopathy, decompression sickness myelopathy. Then risk factors of the vascular myelopathy includes it accounts of all about 3 to 5% of all spinal cord injury cases. It is a subgroup of non-traumatic spinal cord injury, example vascular event, cancer, multiple sclerosis, spinal stenosis, or any infection. This is more often in females, and it includes paraplegic, which is mostly incomplete. In patients undergoes thoracoabdominal aneurysm repair, the incidence of spinal cord ischemia is between 4 to 16%. Then hemorrhagic. Due to hemorrhage, the chances of the vascular myelopathy is also present there. Spinal arteriovenous malformation or any arteriovenous fistula is the most common cause of the hemorrhage myelopathy, which is also known as Cox Alazone syndrome. This is most commonly occur in men and typically in older males than 40 years. It subclassified into spinal subarachnoid hemorrhage. It is less than 1% of all subarachnoid hemorrhage. Then spinal epidural hemorrhage, which occur at least 4 times more commonly than subdural hemorrhage. Subarachnoid hemorrhage and subepidural hemorrhage are the common in men, and subdural hemorrhage is more common in women. It is more predominant in 5th and 6th decades and also peak during childhood. Then von Hippel-Lindau is the autosomal dominant condition that can caused by the hemangioblastomas in the spinal cord, and it occurs, the ratio is 1 is to 30,000 in all population. Then how the disease progresses, its natural history and different phases of the vascular myelopathy. Spinal cord ischemic infarction generally present with sudden onset of neurological deficits, and the pattern depends on the arteries which is involved. Which artery is compressed and cause the ischemia in the spinal cord. Then the symptoms, pain is the most common feature which present early, and other neurological symptoms include loss of sensation, weakness within minutes to hour, bladder and bowel dysfunction, sexual dysfunction, and reduced reflexes below the level of the involvement, and hyperreflexia may later develop with spasticity. Lower thoracic and lumbar levels are commonly affected, and incomplete paraplegia is most common, oftentimes in an anterior spinal artery syndrome distribution. Spinal hemorrhage are usually sudden and accompanied by pain, often localized to the back. Then the most common presentation of spinal arteriovenous malformation is slowly progressive myelopathy, which lead to Diagnostic delay. Uh, Weakness may worsen with extension and improve with rest. Back and lower extremity pain occur in at least 20%, and by time of diagnosis of the arteriovenous malformation, symptoms include asymmetric leg weakness, gait disturbance, sensory complaints, sphincter impairment, pain, and hyperreflexia. And if we did not treat the arteriovenous malformation, then 50% of the patient will be unable to walk within 3 years of onset. Operative treatment has also been reported unsuccessful in relieving motor deficit, gait, and bladder incontinence. Then there are the complications also in the vascular myelopathy, which includes the neurologic bowel bladder, sexual dysfunction, pain, urinary tract infection, pressure sore, depression, and spasticity. And it also includes the comorbidity which lead to the death, which includes hypertension, cardiovascular disease, diabetes mellitus, and arterial fibrillation. Then the assessment of the vascular myelopathy, it includes the firstly history. uh, it can be associated with the medical history of the aortic peripheral vascular disease, vasculitis, radiation therapy, exposure near the spine, or coagulopathy. Then signs of the myelopathy should be present there, which includes the motor weakness, sensory, gait abnormality, pain, spasticity, along with bowel and bladder dysfunction. Then specific syndrome includes the anterior spinalitis syndrome with paresis and spinothalamic sensory deficit. If anterior spinal syndrome is there, then there are the symptoms of the anterior and the lateral tract, which include the pain, temperature, and if